So today I have a juicy, kind of controversial topic, and I'd really like your opinion on the matter. So I'm going to share my position, and I really, really welcome feedback because this is something that we really need to debate. We're going to talk today about whether or not it's appropriate, helpful to have Western medical doctors and personnel either in or at the ready on call near a shamanic ceremony with medicines like ayahuasca and wachuma. So, spoiler alert, my position is that it's not appropriate. And in fact, it's even detrimental. I'm going to make a good case for why, so hear me out. First of all, I'm well aware that there are retreats out there, one in particular that's very famous, that gets a lot of attention and trust because they have and market the presence of both Western medical doctors and psychiatric personnel on staff there to assist in ceremony. And I deeply realize that creates a space of safety for a lot of people that would otherwise possibly not journey with the medicine because they feel it's unsafe. So, let me address the safety factor first. Having 15 years of experience with ayahuasca in particular and 13 years of experience with wachuma, know that although these medicines are incredibly potent, they are incredibly safe. There is one caveat to that is very important to mention, and that is whatever circle that you're sitting with, please make sure that the organizers or facilitators are meticulous about asking you your medical history, both physical, mental, and emotional, everything that you have been through that could potentially come up in ceremony. So, for example, some things that we really look for, if you've had a history of seizures, especially seizures that didn't come about from head trauma, we definitely want to know. If you've had a history of heart issues, especially heart attacks or arrhythmias and that sort of thing, it may not be that you're a candidate for the medicine. Those are a couple of examples. There really aren't very many medical issues that don't go well with the medicine, but those are a couple. And of course, there's a long list of medications that are contraindicated with ayahuasca. So if you've gone through a questionnaire process and an interview and you've revealed these things and you've gotten the green light to sit in ceremony, then please assume that it is incredibly safe. The mode of transportation that you use to get to a ceremony, I guarantee, is volumes more dangerous than the ceremony itself. And I bet you didn't have an ambulance trail you on the way to the ceremony. So please keep that in mind, that bringing in the fear-based assumption that it's dangerous is actually going to create more fear for you and the person around you. So I assure you, it's wonderfully safe if you're sitting with someone who is well-trained and who knows how to make sure that your body and your mental well-being has a strong enough foundation to handle the potency of the medicine. So if all that is a yes, you're safe. So why do I think it's a bad idea to have doctors on call, essentially, to assist if needed? Because in my experience at the retreat, specifically that I've mentioned, that I worked at for about a year, I found that every single time I actually had to call on that medical personnel, it created far more trouble than it did help. So an example, if an individual that, say, was diabetic, went into a space where they were absolutely sure they were having an issue with their blood sugar, a diabetic reaction, and they insisted that I call the doctor, I would. And so the doctor and usually at least one other assistant would come into the ceremony space with no knowledge of how to come in with reverence, how to come in with quietness and respect. They would permeate fear. Now we had one person in fear. Now the entire ceremony is permeating in fear because it's the same feeling that we feel when we see an ambulance of something's wrong with someone. We just assume that, and it's scary. And so their very presence creates this. And most of these people have zero training of how to work in the container that the facilitators have worked so hard to create. So we have the worst possible scenario then, as far as I'm concerned. We have fear now cascading like dominoes through the ceremony space, through the participants. Never in all the times that I was asked to call a doctor was the actual physical issue validated. It was always essentially psychosomatic, which makes perfect sense if you understand the way the medicine works. She gives us this incredible opportunity to feel and acknowledge in an amplified way the state of consciousness that created the illness that we're afraid of. So for example, if I go through this process of thinking I'm having a diabetic episode, the opportunity, the invitation from the medicine is to dig deeper past the fear of into why. Where did this come from? Why has this been happening? And in that curiosity, we can actually come through with the insights of how to heal it. And because any illness whether it's physical, emotional, mental, spiritual, etc., we have to feel the symptoms in order to heal it. We have to. So that's why it's very common that if you're trying to heal something like diabetes, the medicine's going to give you this experience of, uh-oh, I'm in trouble. Now, in the event of something like diabetes, if you have your own ability to bring your blood sugar testing kit or your blood test and validate it for yourself, I welcome that. I'm not there to torture people, but just in that vein, I'm not wanting to torture everyone else in ceremony because someone's afraid something's happening. And that's why the presence of medical personnel from the Western perspective typically creates more harm than good. I have to tell you too, it's just this funny thing that happens sometimes. I have an amazing medicine partner, and I've heard her say more than once to someone who's going through one of these episodes, like, I need a hospital. Her response is, you're in a hospital, bro. And it's true. As shamanic practitioners, we are part of the wellness crew. We might not be respected in the same way that the Western world is, but if you're sitting in an ayahuasca ceremony, at least you have some level of reverence and trust that this is also a valid form of safety and healing. So we are actually trained to deal with the vast majority of really everything that I've ever encountered in 15 years. Even the things I didn't think I was ready to, I figured it out. I am CPR trained, I'm triage trained. I actually have a few things in my toolkit that are from the Western world, and a lot of facilitators do. Wonderful. There's no need to throw that out. But to insist that there needs to be an ambulance outside or Western personnel ready to assist, I hope this gives a different perspective that maybe that could cause more harm than good. If you're one of the people that you just feel like you would never drink the medicine without that presence, I deeply understand and honor that. That's why retreats like that exist. But I hope this offers a different viewpoint, that maybe it might not be necessary for some of you that were on the fence or that were erring on that side without potentially having another perspective. So I so appreciate you listening. I would love to hear your thoughts, so please comment. Follow my channel here on YouTube if you wouldn't mind. It's brand new. This is the first video, and I really appreciate you stopping by. My name is Kat Courtney. I'm the Afterlife Coach, and I really, really hope you journey well. Much love.